We're here today with Dr. Shaker, the owner of Shaker Spine and Sport Institute in Tampa, Florida. Dr. Shaker is a chiropractic physician and holds several postgraduate degrees, including in sports medicine. All right, so Dr. Shaker, what benefits do you see in using the power laser?
I actually see several benefits, and I've used the power laser for approximately 17 years. I have been exposed to several other products in the marketplace, and I've just found over and over that the power laser was actually clinically the most effective for me over and over again.
All right. And has the power laser made it possible for you to treat certain conditions more successfully, or more conditions than before you started using it?
Absolutely. As a sports medicine practitioner, as someone that specializes in injury medicine, particularly extremity injuries, so like shoulders, knees, wrists, hips. And most of our clientele actually are regular people, they're not athletes. But let's say, for instance, the shoulder, in my opinion, has over 19 rotator cuffs, not the 4 that's in the standard medical text. And in order to do exacting specific work on the anatomy, you have to have a device that has a probe aspect to it, so that I can actually do trigger point work, cross fiber massage. The trigenics that I do out of Canada is phenomenal paired with it. So this device I find is extremely useful in getting to the anatomy more effectively than any other device that I found.
Great. And what are some of the most common conditions that you treat with the power laser?
Honestly, you go to Dr.Shaker.com, and there's an amalgam, a plethora, whatever word you want to use, a lot of conditions, many more than I could name in this interview actually. So there's really not common, but to give you a couple examples would be an infraspinatus muscle, which is a muscle in the back of the shoulder that's attached to the scapula. It's a very interesting muscle. It's responsible for forward movement, but also deceleration, and also, that's actually the deceleration part, but then also external rotation of the shoulder is the movement for this, was when it gets activated during EMGs. But also, like in a throwing motion, that muscle will decelerate, and in doing so many times gets injured. There's a trigger point in this area. Many times the patients are asymptomatic. They have shoulder pain, but they don't actually have scapular pain. And so it doesn't show up on X-ray, it doesn't show up on MRI, so it takes a clinician that's knowledgeable about shoulder function to actually palpate the shoulder area to find this lesion. I found this is a very common thing that I found with the shoulder, and the power laser is very effective with all the other modalities that I use. It's my #1 modality that I use actually in my practice.
Great. And do you have a couple of success stories that you could share with us that you've used the power laser for?
Sure. I can't mention any patients because of HIPAA laws,
Sure.
but we've had patients with very bad ankle sprains that have come in here, and it's called in sports medicine a high ankle sprain, and that involves many of the different musculature that's in the lower leg area, and you have to be able to find and pick out exactly which muscles. And these muscles, some of them, like extensor hallucis longus, for instance, is a muscle that starts up in this area of the knee, and it comes all the way down, crosses the ankle joint, crosses the foot, and goes into the hallux, which is the big toe, and it's responsible for extending the toe. It's a muscle that very few clinicians even consider to treat with an ankle sprain, but I find that it's many times involved, and if you don't treat this muscle and upgrade its neuromuscular function, this is when people have the pain just doesn't go away, and they have to do multitudes of therapy and exercises to try to activate the ankle. So the power laser, the probe is small enough that it actually gets on this anatomy, and I can just trace the entire length of it with it. So it very helps. And then also, because the power laser has different frequencies on there, that's mainly the liver channel. And in Chinese medicine, the organ systems are always involved, so I can actually treat the myomeridian with it as well.
Nice. And would you recommend the power laser to other practitioners?
I have in the past, and I will continue to do so if they listen.
We appreciate that.
You're welcome.
Anything else you'd like to add?
Well, it's just been a pleasure to meet Arnie and yourself on this trip. I'm very happy that you guys showed up on my doorstep to come in after all these years of talking to you on the phone, via internet. I think Arnie has done an amazing job, just brilliant work developing this incredible laser. It's helped so many thousands of people get out of pain. Another example, you guys were just here to see me treat a wrist, and the patient had his wrist was in excruciating pain, so much so that I couldn't really do the trigenics technique. So I used the laser to calm down the inflammation, and as you saw, I was then able to apply the trigenics technique, whereas without it, I wouldn't be able to do it. And so we did a combination of the laser and the trigenics. He actually had Carpal Tunnel Syndrome, is also deck-core veins, so carpal tunnel runs through here, deck-core veins runs through here. And with one trigenics treatment, how much improvement did he have? Remember what he said?
50%.
50%
Right.
after one treatment. So.
Great. Thank you very much.
You're welcome. It's my pleasure.